Yes. Hello, hi, I'm Mayor Kramer. Sorry about the delay, a little bit of technical difficulties. We learn a little bit each time we do this. I am joined, I guess you can see 11 of us. We have Michael Steinbrook, who's running the show, myself, Mike Rossi from the Food Bank, Bob Vornlocker, who is everyone's complimenting me on the great job I'm doing. It's him that's really doing it. Will Galtieri, who is councilman in the second ward, helping us with our volunteer efforts. Malik Lyons from Tapped Into, Lieutenant Phil Rizzo, who is representing the department. We have Bill Bowman from the Franklin Reporter, as well as PJ Parker. And Jim Wickman is our special guest, who's, we'll get into why he's here. And then, of course, the person who's holding our school system together is Superintendent John Ravalli, who I have great appreciation for. Helping us in the background are Neil Bitwin, who's helping us with technical assistance. And this is his Zoom account. Is that right, Michael?
No, my Zoom account, but I changed a lot of settings for security, so he's helping me work out the kinks.
Okay, Ed Potasnik helped, and Jessica Sullivan will be annotating the calls. So that's for the thank yous. Let me get into the issues. Obviously, this is a terrible situation we're in, and we're all suffering here. But we're suffering together, and the more we help each other, the less the suffering will be, and the sooner we'll get out of this. I'm going to stress a few things here. Almost all your questions, scientific and legal, can be answered at covid19.nj.gov. It's really an incredible site, covid19.nj.gov. One of the issues that, of course, has come up lately is the closing of parks. The governor, was it yesterday? I'm losing track. I think so.
Day before yesterday.
Day before yesterday. Closed the state and county parks, and we followed suit immediately. One, I agree with his closing of the parks, so I'm not handing it off on him. But once he did that, we realized with the way Franklin is set up and the way our parks are, that people will migrate from the state and county parks, and they will start flooding our parks. We already had a social distancing issue in our parks, and it was just going to get worse. So I agree with the governor, and I believe our reaction was correct. People are dying. Over 2 days this week, over 100 people were tested positive. So I'm sorry for your suffering. I'm sorry for the pain of not being able to go out and exercise when you're caught at home, but I just think it's the right thing to do. Masks. The governor has said now to go into any retail stores that are exempt. Both the people, the employees, and the people going in must be wearing a mask or some type of facial covering. I showed you how to put on a t-shirt and make that a mask. Anything like that is acceptable. I again agree with the governor. If I had the power, I would have done that in Franklin earlier. There have been some few questions about whether race is a factor in COVID-19. Some states, including New Jersey, have reported that African Americans and Hispanics are getting COVID-19 more frequently than other races. And that's extremely concerning to me in general, but of course in Franklin, because we have large portion of our population fits those two demographics. So I'm very concerned about that. I want you to know, however, that the state data, well, let me back up. When you report a COVID-19 case, it is not required that you report race. So of all the COVID-19 patients, that have been reported in the state, only 19% of those identify race. From that, they came up with their figure. That's, I think it's a point to be brought up. I think people should be aware of it. I don't know exactly what it means when you base your data on 19% of your data, or you base conclusions on 19% of your data. The statistic is worse for Franklin, worse in that we have less than 19% compliance with that particular variable. And so we don't know what's going on in Franklin. I worry that it's true, but I don't know that it's true. I do want to talk about doubling, and you can look in some of my posts. They're easier to find on mayorkramer.com, not the Facebook page, but just a regular web page, mayorkramer.com. You can find some articles that talk about doubling. So it's one thing to say that the cases are going up by 20 or 30 every day. But if you imagine when one person is infected, that person can only infect so many other people. When 5 people are infected, there's that much more potential to infect other people. So it is not just the number that's going up, it's how quickly the number is doubling is a very important factor in figuring how well we are doing. For more information, again, look at those articles. But our doubling rate is going up. In other words, it's taking longer to double our numbers. And that's important. New York State is doubling at 10.7 now. They're talking about getting to their peak. They're doing better. We're doubling at 8.9 now. That's for our state, the way I calculate it. And there's different ways to calculate it. But the best I can tell, we're about 2 days behind New York State. So things are, it's a light at the end of the tunnel. I don't want to say things are getting better because things are actually going to get worse before we reach that peak. And then even after we reach that peak, we have to come down from the peak, and there are more and more cases. But there is a light at the end of the tunnel. There's been, next topic, there's been a lot of talk about property taxes being delayed or increased grace period. We're hearing a lot of chatter. One day it's going to happen, the next day it's not going to happen. It's really anyone's guess right now as to what's going to happen. There are issues, and so we don't know. It's happening at the state level. We just got a message that the state will not be voting on it again until Monday. Or in fact, I don't think they're. That's right. You're shaking your head, manager. They're not even going to vote on Monday. So we really don't know where it is. It's in limbo. We can't act until they act. We are mandated to follow the May 1st deadline, well, with a grace period of 10 days, unless the state relieves us from that. When I know, you'll know. Again, people keep asking me, can I tell people, can I report the locations of where the people are who have the positive results? No, I can't. One, I do not know them. Only one person in town does, and that is not me. I am not even privileged to that information, and I don't ask about it. No, we cannot break it down to wards. No, we cannot break it down to zip codes. We don't have that information, and there's not enough of the information, and there are not enough cases for that to really be meaningful information. So I keep being asked about it. I understand you're asking. I'm not blaming people about it, but I really don't have the information, and we will not be giving it out. And then the last point I have is a non-COVID thing is the census. Please fill out your census. This will be over one day, and that census information is going to be important. I do have one other thing, and this will be a good segue to Mr. Wickman, who was kind enough to come on. Our healthcare providers are doing an incredible job, and they are not just working hard, they're doing it at risk, at great risk to themselves. Along with that are not just the doctors, not just the nurses, but there's also the support staff in group homes who are low wage, at high risk in this, and they need a shout out. So there's a lot of healthcare providers out there that are doing things, and it's up to us to maintain our social distancing because they are at risk, and they're at risk longer and greater if we don't. With that, I'm going to segue to Jim Wickman, who is a fire commissioner and also a nurse at the Robert Wood Johnson Emergency Room. And so he's on the front lines in two ways. And if he could just spend a couple of minutes letting us know what his life is like lately and any words of wisdom for us. Take it away, Jim.
You're unmuted, Jim. Go ahead.
Thank you. Thank you, Mayor. One correction, I'm not a nurse in the emergency department. I'm an emergency department technician who works with the nurses and the doctors and the respiratory therapists and the x-ray people. I'm kind of that middle guy that works with everybody.
You're still my hero.
That being said, what I can tell people is this. It's very simple. I go to work at 6 o'clock in the morning. I get home at 4 o'clock in the afternoon. And then I do my dual duty as the chairman of the board of the fire district to make sure the fire district is being taken care of. And so somewhere around 12, 1, 2 o'clock in the morning, I get to go to sleep. And that's okay. That's what we do. The message is this, and it's very simple. People need to listen to what's being told them. I know it's inconvenient. I know people don't like it, but please wear your masks, stay home. Everybody complains about going to work. Here's an opportunity to not go to work and stay home and be with your families. I know that's not the easiest thing in the world, but please do it. Please stay away from people, social distancing, wearing masks, washing your hands. It really makes a difference. You don't understand. On the front line, the volume, and I cannot speak for RWJ Barnabas, and I wouldn't do that. That's not my position. But I can tell you this. Volumes are low. The sick people are really sick. And you don't want to do that. You don't want to be there. Just please take care of yourselves, take care of your families. On the fire district side and the fire protection side, I can assure you, you are well protected. We have plans and protocols and processes in place to minimize the danger to our firefighters without affecting your safety as the residents of Franklin Township. So there are protocols in place that we've adjusted and managed things, thankfully in cooperation with Franklin Township and our shared services. We are answering calls. We are doing it well. We will be there. I can guarantee you we will be there. It may look a little different. I'm not going to go into the details, but we will be there. It's behind the scenes that we are managing our firefighters, our volunteers, and their families to make sure they are safe. If they're not safe and healthy, just like in the hospital and the emergency department, if we're not healthy and safe, we cannot help you. The way we stay healthy and safe is you stay home, you wash your hands, you wear your mask. When you go to the store because you need things, and make your list, buy your stuff, go one time and go home, and just stay away from people for a little while. That's all we ask. It's not difficult. It's unusual. It's new, but it's not difficult. Please just do it, because there are people out there that are in it. We are in it every day. I'm there 10 hours a day. I'm in it. And there are thousands of other people that are in it. And that's what we do. We're not complaining. It's what we do. But please help us be able to do what we do and help those people. So it's a little bit of a desperate plea, but I do make that plea because I see it. I see it every day. And I see the stress and the anxiety on my coworkers having to deal with this. And believe it or not, They keep showing up every day because it's what we do. When you need the fire department, we will show up. It's what we do. When you need to go to the hospital, we will be there. It's what we do. It's a calling. The police, the fire, the EMS, the maintenance people in the hospital, the cleaning people in the hospital. It's what we do because there's a calling there. But please help us. And I may be begging a little bit, but I am begging. Please help us so we can do our job and minimize this issue as best we can. So thank you, Mayor. Thank you for having me on tonight.
Thank you, Jim.
I'm
You're,
welcome to show up for you anytime you need to help you out. Thank you.
thank you. You're a double hero. And if you want to jump off and grab dinner, I know you've been working hard. That'd be great.
Hey, Phil?
Good.
Phil, we have Mike Rossi from the food bank, so he was going to be presenting along with Jim. Do you mind if we just go ahead and let him give his update before
Sure.
we go to the panel?
Sure. I do, after that, want to jump to Dr. Ravalli because he's also working hard all day and he probably hasn't had his dinner yet.
Okay. All right. So Mike's just got a quick minute for us. Go ahead. Go ahead, Mike. You're unmuted.
Just an update. We have seen in the last 17 days, 163 new families come to the food bank for assistance. We have seen over 880 families in the last 17 days. The surge is coming and it is growing. We are on an appointment-only basis for the safety of not only the staff, but also of our clients. And we are evaluating whether we need to purchase food on a daily basis and weekly basis. We are have lost our two biggest fundraisers. The Tour de Franklin has been reshaped and Empty Bowls was canceled. And so we are actively fundraising to replace that income, which we expected. And so we are still there. We're like Mr. Wickman said, this is what we do, and we will not shy away from providing food to all the families in need, especially the new ones with something like 10 million people, or 10% of the workforce laid off in the last 3 weeks. My thanks to the mayor and the council and Mr. Vornlocker and everybody else for their support going forward. And in the past few weeks, Bob, PJ, and Malik also publicizing the need. We're going to be there. Please, though, stay safe. And if you want to donate, please donate on franklinfoodbank.org. You know, for every dollar you spend on a can of food, we can get 3. And your safety is of utmost concern to us. So thank you. Thank you, Mr. Mayor, and everybody else for having me on.
Thank you, Mike. Appreciate you taking the time. We want to go over to Dr. Ravalli from the school system. Gonna unmute. You're unmuted. Wait 1 second, John. Do you have yourself muted, John? There you go.
Now.
There you go. You're good. You're good.
Well, thanks, and thanks for having me. So I just wanted to provide an update. You know, right now with remote learning, we are on spring break. We pick back up with learning phase 2 remote services on Tuesday, April 14th. We are ready. We have lots of new and exciting activities. The folders are built, and we will be making our web page for remote learning live again on Monday afternoon, so that folks are able to access that and be prepared for Tuesday. We're continuing our efforts to feed our families. We're serving a little more than, or a little over 3,000 lunches and breakfasts. What has been twice a week will be Tuesday when we come back from break, and then we'll be announcing our process going forward. And we're going to continue. My understanding is that the governor's office, in concert with the NJDOE, will be making some announcements next week with regard to where we stand and what perhaps the remainder of the year will look like. So we're waiting for some of that information, but we are planning about releasing information in a week to 10 days on what our last marking periods will look like, what our grading system will be here from the remainder of the year, because obviously that's going to be a change from what our typical grading profiles are. So we have all of that in the works. We'll be making some confirming adjustments or making some adjustments to that, working with our teachers next week, and then we'll be releasing that information. Of course, the seniors are on our mind. Our graduating seniors are on our mind. Our guidance counselors are reaching out and will be reaching out to touch base with each of our seniors when we return from spring break. Our high school principal is working to perhaps work with the kids, the student government, grade 12 student government, and perhaps through our PTSO on what graduation might look like if we're not back in time for graduation. And, there are lots of ideas floating out there across the country and even locally. So he's having some of those discussions now, and he'll continue those discussions. And sometime, likely in May, we'll be finalizing some of those plans if we're not able to have a traditional type ceremony and the traditional activities that go along with it. Although we are planning for that, should we be able to come back and do some of that. We've put the appropriate plans in place, and we'll continue to make those plans in hopes that perhaps our students will have a more traditional kind of ceremony at the end of June. But if not, we want a contingency plan, and that the beginnings of those discussions took place just before spring break, and they'll pick back up afterward.
Okay, thank you. By the way, Freeholder Director Robinson has sent me a text saying that she is on another COVID call. She'll get to us if she can. Go on, Michael. You're muted. Now I'm not muted, sorry. Michael, you're muted. Why don't you take it away?
Apologies. John, Dr. Valley, I was just going to say, do you need to get going? Because if there are questions that pop up in the feed, I can note them and send them to you.
I can certainly hang for a while.
Okay, all right, I appreciate it. So let's go ahead and go to Township Manager Bob Vornlocker, if you want to give your update, Bob. Appreciate it.
I think that my update has kind of been covered by the mayor, and I don't need to repeat what he said. Now, he and I have been working very closely together on all of the different aspects. I guess the only thing that's new probably since the last we talked, in addition to the parks and things like that, is so we continue to look at how our staffing is done within all of the departments of the town. We're now looking to move with the cooperation of our police officers. We're going to move them to an alternate schedule to better protect them and give them longer periods of time. They'll work longer periods of time when they're at work, but then they'll be off longer periods of time so that they can self-quarantine and not be exposed, not only in honesty to the public, but to themselves and to each other. The idea here to distance them. And so that will begin on Monday as they transition. Dispatchers have transitioned, I think, last week in the same manner to a longer day and a longer period of time off. The coverage is not affected. The same number of officers will be working on any given shift. It's just that they'll be working longer hours. Basically, what you do is you compress 3 shifts into 2, so that gives you the available manpower to do that. So that's the most recent change as far as staffing. Otherwise, the governor's executive order related to construction projects will have little impact on our inspectors. They'll still have to go out and do inspections. There's a number of construction jobs that will require building inspectors and engineering inspectors to continue to work. They continue to work alternating weeks, and while at home, they're actually, our subcode officials are actually reporting from home on their weeks off if necessary. So that type of activity still continues. Government is still continuing. You know, we're there. There's people in the building every day. I'm in the building every day. And services have not lapsed at all. It's just that we're doing it in a different way these days. And there's one other thing. So and this is just maybe not really related, but one of the departments that we get asked about often is animal control. I met with the animal control officer yesterday, Katie Nordhaus, and the animals are still getting out of the pens and into walking. There's a fenced-in area next to the animal shelter, and the staff is taking the dogs out every day to walk them, and so they're still getting their exercise. And a day late, but happy birthday, Katie. And I know she's watching right now. I saw on the Facebook feed. So Katie Nordhaus, happy birthday. And that's all I have.
Great. Happy. We won't sing right now, but in here where it counts. So thanks, Manager Vornlocker. And now I want to go over to Lieutenant Phil Rizzo with Franklin Township Police Department. Take it away, sir.
Well, the manager basically covered anything I would have spoke about. Our officers are still out there 24 hours a day, 7 days a week, patrolling the streets and handling calls for service, doing everything they can to keep themselves and the town safe. As the manager stated, we are approaching an alternate schedule next week. Again, won't affect service. Officers will still be out there, same number of officers. And that's really it. We're just out there doing what we have to do.
Thank you very much. And I just want to open it up to Councilman Galtieri, if you have any updates regarding the collaboration for residents helping residents.
Just a big shout out to the group overall. We've got we're approaching, if not exceeded, about 100 volunteers so far, and I know in the coming weeks there will be an increased demand, increased request for help, and they're starting to see more. So thank you to everybody who's stepping up and helping. It's greatly appreciated, and those that are helping with food distribution, both at the food bank, at the Zarephath Food Pantry, the organization that came up, Salt Foundation Inc. So. And on top of that, all our banquet halls and restaurants that have had to close, that are offering refrigeration space now, so we can get more food supplies in and last longer. So again, please reach out to the group that's been set up, the Residents Helping Residents Franklin. They do want to help and try to make sure that those that are at risk can still get the food that they need and delivered to them, and also to protect the health of everybody. So that's all I have right now.
Okay, great. Thank you very much. And we have both of our local press outlets here. This week I'm gonna start with Malik Lyons from Tap Into Franklin. Malik, I'm gonna unmute you here. So if you have any pre-prepared questions for the panel, I'm gonna give you some 5 minutes or so to use that. So go ahead.
Okay, thank you very much, Michael. One question that I did have was Colonel Callahan of the State Troopers had mentioned since January 1st that there's been a significant drop in crime. Do we see the same thing reflected in Franklin Township as of right now?
Malik, we've seen a drop in all of our calls for service. So more people are home. That obviously leads to less opportunity for crime. So while crime is not completely eliminated, we have seen a reduction pretty much across the board in all of our calls for service.
Thank you. One other quick question. In some locations, in some other towns, they're looking to use different hotel facilities to house COVID patients. Is Franklin looking at that at all? Because we do have a lot of hotels in this area. I think we probably have more hotels per capita than any other town in New Jersey, except for maybe Atlantic City. So are we considering doing anything like that?
So I'll answer that, Malik. So the answer is that through our emergency management office to the county emergency management office to the state emergency management office, locations that could be used as a alternate hospitals in the event that all of our hospitals become at capacity have been, those locations have been provided up through the chain to the state, and there's a number of locations in Franklin that were provided in the event that they're needed. So, and hotels among them, but not limited to hotels. There are other facilities within Franklin Township that could provide that should it be necessary, and those locations were provided. I'd rather not speak to which ones they are because they're not being utilized. Certainly, if they became utilized, it would become public. But given the fact that it's not been activated at this point, I'd rather just not give the location.
Thank you. One final question, if I may. This weekend is a very significant weekend for a lot of houses of worship, and I was wondering if there's any type of what's the protocol? Because I received a couple of emails and calls about certain houses of worship in the town that may not be practicing social distancing. I wanted to find out if anyone else has heard that, and what exactly is the protocol? Like, will people be required to wear a mask if they're doing anything within these houses of worship? What exactly would be the protocol there?
So the executive order clearly states that no place shall have a gathering of more than 10 people, and all houses of worship are held to that standard like any other location. And in the event that someone had one of these houses of worship had more than 10 people gathering at one time, and they need to be reported to the police department, who locally is the enforcement agency. And that's what needs to happen. We're not aware of any houses of worship that have been holding services. And if someone is, they need to call the police.
Bob, should they call the non-emergency number?
They should call 732-873-2300 and speak with a dispatcher in dispatch. That's what they should do.
Thank you. That's it, Malik?
No, I wanted to also ask if we've seen I know that other people have reported this, like issues with people leaving masks or gloves or any other things discarded in any of our local establishments. And what exactly should someone do if they see someone doing that? And if we have seen an uptick of it?
So I'll certainly take some input from Lieutenant Rizzo, but I make my rounds every morning. This is not a time for me to sleep long, so I'm up very early in the morning, and I get to witness all of our grocery stores as they're opening and beginning to provide the hour-long period for our older residents and those that are immune deficient. And I certainly see in the parking lot what you speak of. It's a shame because there's garbage receptacles at every cart storage area in every parking lot in all of our our grocery stores. So I'm not quite sure why people feel the necessity to put the gloves and masks and throw them on the ground. There certainly is a readily available garbage bins for them to put them in. But the answer is it's littering. This is not something that needed to have an ordinance or law created for it. It's littering. The littering ordinance has been on the books since there were books. And certainly if people see it, they should report it to either the store security or the police department, or our police officers are trying to, that's one of those things that it's not easy to catch people doing. As the police car drives through the parking lot, it's unlikely that the person is going to throw their latex gloves on the ground. They only do it when there's no one around, and that's why they pile up on the parking lot. But if you see someone do it, report it. I wouldn't confront anyone. That we're not looking for confrontation between citizens, but report it and get a license plate number. It's unlikely that the person is going to throw their.
We good?
Yep.
Okay. Thank you, Malik.
Tomorrow, someone gave me the idea of showing people how to get rid of their gloves, take off their gloves. So I'll probably
proper
make a
way.
video on it.
You beat me to it, Mr. Mayor. I was going to see if you had a pair around if you wanted to do a live demonstration of how to properly take off your gloves, but we'll save that for a video to put up on your page.
I'll probably video it so when I get it wrong the third time, and finally get
Much
it right.
rather put you on the spot
Yeah.
on live Facebook. Okay, thank you. All right, we're going to turn it over to the dynamic duo from Franklin, reporter and advocate, Bill Bowman and PJ Parker. Who's going to kick us off? I'm going to unmute you both right here.
Ladies can go first.
Okay, thank you.
Gentlemen.
Again, I want to thank Mayor Kramer for organizing this and for being the solid leader in Franklin Township that people are really grateful for, the constant updates and obviously the benefit of your medical background as well. My question, I do believe, is going to be directed to Lieutenant Rizzo, and it does go back to the issue of the masks, which we started to chat about last week. I'm very pleased to see that the difference in the response that people have to wearing masks has been like night and day. Supermarket visits last week, where there maybe were not even 5% of the population who were in the grocery stores wearing masks, now is virtually every person. So the consciousness has definitely been raised. However, there's always one or two who thinks they either aren't paying attention or they don't care what's going on, or they're just oblivious. And I ran into one such couple who didn't have masks on, weren't wearing gloves. They were handling fruit and potatoes as if they were playing marbles in the street. And quiet soul that I'm not, I did walk up to them and say, are you planning on taking every one of those potatoes? Because your hands have been all over them. Oh no, why should I? Okay. I was about to go somewhere that I shouldn't and didn't. And my question again to Lieutenant Rizzo is, the enforcement is what in terms of the police? In terms of us as ordinary citizens, when we see an infraction that is that dangerous, not just the handling of the fruits or the vegetables, but the fact that that people are still not wearing the masks, which have been proven to be so effective in preventing anything coming from what we may be transmitting to someone else, and also from somebody else transmitting something to us. This is now not a choice. This is something that we must do in addition to washing our hands, is we must wear these masks. When we as citizens see that there's an infraction, what is our recourse? Do we go to a store manager and hope that that's going to be addressed? Do we call the police department? What is your advice, Lieutenant Rizzo?
Well, the masks have actually now, the key point you made, are now enforceable. It's just enforceable under the executive order. Prior to that, it was not. So you can always contact the police if you want to try and handle it through store management first in a peaceful manner. That's always an option as well. But you can always call the police and we'll respond over. You want to try and avoid that confrontation. I've known you for a while, PJ. You're not one to avoid the confrontation, but you
do need to qualify that. It's always for good, for higher good.
But yes, you can report that to store management, and they can handle it on their level, or you can report it to the police department. And now that it is in the executive order that to be in an exempt store, you must have a facial covering. That is enforceable.
Well, what I would like to suggest is that perhaps there is some sort of memorandum that is issued by the police department to the grocery stores that indicates that this is now mandatory that you wear a mask, and anyone who is in violation of that is going to be enforced to be compliant.
PJ,
Now, is that something?
I'd just like to interject here. So while I will say with absolute certainty that every grocery chain in the state of New Jersey is aware of the executive order from the governor and doesn't need a memorandum from us. Also, I had an opportunity to watch the press conference done by the governor where this executive order was rolled out. And it was made very clear in that press conference that if someone were to go to a grocery store without a mask, they were going to be permitted into the grocery store and their time in the grocery store would be limited. That's not coming from Bob Vornlocker. That's not coming from the Township of Franklin.
Wow.
That's coming from the state governor. So I'm telling you that While it
Wow.
might be in the executive order, your question should be directed to the state, not to the Township of Franklin.
Wow. Okay. Well, lest there be some misunderstanding, I am aware that the supermarkets and their staff are absolutely aware. I meant the memorandum more for the average person who walks in the door and sees that, oh yes, I should be doing this. So that's interesting. So it's like there are some states that are not requiring shelter at home either. So that's dangerous. That's my opinion. It's dangerous. Everyone should be required to be wearing masks, especially in a food environment.
Right. Thank you, PJ. Any other questions from Franklin Reporter and Advocate?
Yeah, I do. Are you done, PJ?
I'm finished.
Okay.
Thank
All
you.
yours, Bill.
This is for the mayor. Mayor. You mentioned the other day the chart that the State Office of Innovation put out that was used in the governor's press conference on April 6th, where the State Office of Innovation identified, I think, 6 or 7 zip codes that the state was looking at in terms of surges of coronavirus patients. 08873 was on that list. So I wondered, now I have not been able to get the state to say anything about it. It's been 3 days now, and they're still not answering my question. Just wondered if you've been able to get some sort of explanation, as I know that they got the data by the self-assessment. That is probably the most unscientific way to gather data for any sort of pronouncement of something that might happen. So have you been able to get any more concrete information from them about how they went about parsing this data?
So just before I answer that, you saw me looking at my phone. Freeholder Director Robinson won't be able to join us. She's still in her conference call. So I made a lot of noise about that. And my objection was not that if Franklin is a hot spot, that we let people know. If Franklin's a hot spot, it's appropriate to let people know. But that I wasn't called so that I could understand the methodology that it came about, so I could give a judgment to that the neighboring hospitals, maybe they were called, but I wasn't told about that. I mean, one would think they would be aware. One would think that our police officers and other first responders should know about that, and I wasn't called. But you made the point for me that what is the methodology, and the methodology is terrible. It's self-assessment. I went on that site just to try it out and see what kind of answers it gave. Now, I put in all zeros for my zip code because I figured they might be doing some data mining from it, so I wouldn't mess up their data mining by putting in my actual zip code. But Councilwoman, she used to be Councilwoman, Freeholder Director Robinson did get to speak to some people at the state. The state did acknowledge that it was not the best planning to do that. They acknowledged many mistakes about it. And though 2 days ago I looked at the Facebook page of the New Jersey Department of Health, and it was still on their Facebook page. So, you know, they haven't responded to me. I've tried several times. I've talked to members of the Office of the Governor. They did talk to the Freeholder Director. They acknowledged the inappropriateness of it. And I think it's time for me to move on it. You know, I hope they'll take it down from their Facebook page, but I can't get caught up with it anymore. Hopefully I've yelled at the umpire enough so that the next time there's a similar call, they'll make the appropriate call. How about that? A sports analogy from me.
There you go. And baseball yet.
Yeah.
Okay. I don't know if this is for you or for Lieutenant Rizzo, but somebody mentioned, I think it was the mayor, but somebody mentioned an incident in the park with social distancing. Can one of you elaborate on that?
That sounds like a police issue.
You're saying a specific issue was mentioned?
The mayor mentioned that there was an incident in a park concerning social distancing. I just wondered if you knew about that, if you could just give some details about that.
So I'll talk now, Phil, and I don't mind. So there have been a number of complaints, both through my office, through the mayor, through the police department, about ongoing pickup soccer matches in various parks throughout the town. It's one of the things that led us to make the decision to close the parks in conjunction with the state parks and county parks. With those parks closed and our parks already having issues like that, where people were defiant to the fields being closed, the decision was made to close them. That's what happens.
Okay. Have there been summonses issued? I know.
I just told you that there were people that were doing it and the people were told to leave. There were no summonses issued.
Okay. Have we had any issues of people having parties? I know that in some towns in the state, there have been gatherings of 40 to 50 people and folks have been arrested. Have we had anything like that in town?
We haven't had anything like that reported to us.
I do get people reporting to me on my Facebook Messenger, which I don't see that often. I maybe look at once a day, that they're doing that. And my response to all of them, and thank you for the opportunity to say it, is you can let me know, that's fine, but let me know after you've reported it to the police. That's the proper way to do it. And it's fine to let me know so I can kind of be monitoring it too, but don't report it to me and feel like you've done your duty. Let me know after you've reported it to the police.
And if I can segue with that, we have had several reports to us through our Facebook page. While we monitor that, we do not monitor that 24/7, and it's not monitored constantly. So if you need to report something like that, you do report it to the non-emergency number, and you can remain anonymous. But to ensure a response, you need to report it through dispatch.
As an example, I have the privilege of living right on the canal, and I can see the canal path from my property. And I saw someone biking with his son on the canal, and I totally wasn't supposed to be there, and he did not seem in his response that he was going to leave immediately. I called the police.
Okay. I guess that's it.
Okay, thank you, Bill Bowman and PJ Parker from the Franklin Reporter Advocate. Thank you to Malik Lyons from Tap Into. I'm just going to mute you all now, and we're going to move toward some of the questions coming off of the feed. If you all happen to have a second device where you're catching anything, please chime in. I have a couple of things. First, I'm going to start with Mike Rossi and then go to Dr. Ravalli. But Mike, one of the viewers is curious, and I don't know that if you hit this in your update before, but they're curious if you had any kind of supplemental funding subsequent to the COVID-19 outbreak, be it local, county, state, or federal, to help support the food bank.
We have applied for multiple grants and other programs, both at the federal and local and county and private foundation levels, to help supplement to purchase food and continue operations. So yes, we've applied. That funding hopefully will be fast, but it's a process that unfortunately is a moving target and very fluid. And so as we are able to receive that funding, we'll give updates going forward.
Okay, thank you, Mike.
Before you go on, Mr. Bowman caught me. I was touching my face. Obviously, once you've washed your hands, you may, but no excuse. I should be setting an example. He's right. Don't touch your face.
And I coughed into my hand.
And don't touch other people's faces.
Don't cough in other people's faces. That's for damn sure. All right. All right, so we, Dr. Valley, we had somebody who just wanted you to elaborate. They weren't sure about the number of meals that the school was providing, if you have a figure, and kind of how they're being distributed. I don't know if you can give us a little bit of detail on that.
Am I unmuted? Yes, I am.
I did it for you.
Yeah, thank you very much. Thank you,
It's
Michael.
my only function, really.
Yeah, it's 3,000 plus. I think at last distribution, which was Friday, for multiple days worth of meals.
That's per week?
Per week, right. Well, no.
Or tally, total tally.
Total tally for this happened to be for a week. It was close to 3,600 meals, I believe. And then on Monday, prior to that, we did about a similar figure, somewhere around 3,400 to 3,600 meals. Now that includes a breakfast and lunch. They're go packs, and how they're distributed at 4 different locations, 4 different schools: Pine Grove Manor, Hillcrest, Hamilton Street campus of the Franklin Middle School, and Elizabeth Avenue School. And it's our staff, it's Franklin Township BOE food service personnel. They're creating the packets in the SGS campus, and then our transportation folks are distributing them to the 4 sites. We're also distributing to 30 different bus stops throughout town. Actually, I think it's up to 32 now. And that's basically the process. And that's, breakfast and lunches together equal that, 3,000 plus meals. And yes, it is Franklin Township BOE folks. It is Franklin Township BOE meals.
So Dr. Valley, I have a question I thought I might follow up with, is that, so that's folks that have been determined eligible for free and reduced lunch, and under the circumstances with unemployment rising for a number of folks, what's the relationship between, kind of how you get that status and how they get to a point where meal?
So no one's been turned away. So we're following the Department of Agriculture summer serving guidelines. Nobody's turned away. So doesn't matter what the status is. No one's asking for your identification. Summer serving, the Department of Agriculture summer serving procedures allows for serving anyone who shows.
Okay.
So the go packs are distributed to anyone who is in need and who comes. We would ask it be those folks that are in need, obviously, folks that would benefit most, and those are the folks hopefully that are coming. And again, we're at 30 different stops throughout town, and we've added a couple because folks have called our transportation department. And I would like to take an opportunity here to say that if a bus isn't near you, or you're not able to get to one of the schools, call our transportation department. We've added stops along the way to make sure that everybody is getting what they need.
Okay, great. I think there are some questions here about masks and what an appropriate mask is. This might not be the forum for it, but I think, I don't know if the mayor's there, but if there's anyone who has a resource for people for masks, or if not, I can note it and we'll find it and put it up on the mayor's page.
Are you talking about masks?
Yeah, there's this question about, kind of what constitutes an appropriate mask. I know there's a whole range and that kind of thing.
So, I hold them in front of me. So yeah, I saw that question, so I ran to get masks. This is an N95 style mask. It is not actually an N95 mask. It's a dust mask that you might use doing some carpentry that I've had. It offers a little bit of protection, but an N95 is designed to protect the wearer. You put it on, you form the metal seal, and it protects the wearer. The CDC says it's not great at protecting the people around you, especially the ones that have a valve in the front. The valve makes it more comfortable for you. You don't get a bunch of the suffocation or the stuffiness that you get with wearing this exact type of mask. But that particular mask, what you is just coming right out into the air. That's what that valve is designed to do. This is a surgical mask. I get one surgical mask a day at work, but you can reuse them. It's not optimal, but at least this will offer some protection out there. Surgical masks, if you think about it, when a surgeon is operating on someone, he's generally not worried about catching something from the patient. He's worried about infecting the patient. So what a surgical mask does is it protects those around you. And that's what the CDC is now recommending, and the governor has asked people to do, and is requiring people, requiring air quotes, to do in grocery stores, et cetera, is protect others by wearing a mask. So I actually, because I did a bunch of woodworking, I have this, I put this on, and I put the surgical mask over it. So this is protecting me somewhat, and this is protecting you somewhat. Those are the different types of masks. The cloth masks are not as good, but they do give you some protection. And even the surgical mask gives me some protection. So, you know, it's not a perfect world, as we should all be aware of right now, but the best mask you can wear is the best mask you can have. Please, please, please wear a mask, 6 feet. Don't touch your face. Sorry that I did. Wash your hands, etc.
And there was a comment just asking to clarify that for the most part, those masks are to protect others from droplets coming from the wearer.
The cloth masks are primarily to protect others, but there is some protection for you. Yes.
Okay. And Township Manager Vornlocker, I know you answered this last week, but just quickly, there was a question about construction and projects on people's homes, and if there's a differentiation between projects and, say, projects where, you know, if your roof is leaking or something like that.
So the new executive order from the governor now puts restrictions on certain types of construction. It's fairly liberal in its application as to what is permitted to continue. I think that for the most part, what people are here to listen is it would be residential construction. So if your house is occupied currently and is under construction for some purpose, whether it's an addition to your house or a renovation to your house, interior, exterior, whatever it might be, the construction company is limited to 5 people, and they have to maintain social distancing as best as possible to complete their task. New construction of residential properties are permitted under a number of circumstances, mostly where there is some contractual obligation to complete the construction by a certain date. So if you are having a new house built and you have a contract with the builder to have that house done by a certain date, that contractor can continue to work on the house to meet that legal obligation under the contract. So those are the type of things that can be done as far as residential construction is concerned. And obviously, if there's emergency work that needs to be done, that would not be prohibited by the executive order.
Okay, thank you. There's a question here, and I'm going to put it out to Mike Rossi. People are asking specifically if they want to donate to the Franklin Food Bank. How might they do that? And if you could mention the ambassador program might be good.
Absolutely. And so you can go directly to franklinfoodbank.org. Right on the splash, the homepage is a Donate Now button. We'll take you right to how you do that. The ambassador program is a program we've set up for ongoing monthly support to ensure that there's funding for operations going forward in the future. So you do one or both. They're both very exciting programs, and we appreciate anything you can do as we expect the number of clients to increase significantly in the weeks and months ahead. This is a marathon. This is not something that's just going to come and go for so many people who have been affected by food insecurity and then all the new people being laid off. and experiencing it for the first time. So please help.
Yep. So, and I'll, and there is some, a question about, and I also had an email asking about what the status is and what the condition is of folks who do not have houses at the moment, who are homeless in the area. And I don't know if we have, I can provide a little information, but I don't know, Mike, if you have any, or if anybody else has any information they can.
I have a little bit.
Okay.
So we are not aware right now of anyone who, and when I say homeless, there are a number of people that fall into the category of homeless. However, I'm saying without temporary shelter. What I am aware of is if anyone finds themselves without shelter, they should call 211, which is the state number, and they can then tell the person who answers the phone that they have no means of shelter, and the social services department for their county will be contacted and temporary shelter will be arranged. One of the transient housing exemptions to the executive order of the governor is for just that purpose in hotels. And if need be, our Somerset County Board of Social Services here for Franklin will provide temporary housing on a short-term basis until more permanent housing can be found for anyone who is in need of that. And I had the opportunity to use that service last week.
And yep, go ahead, Mr. Mayor.
Malik sent me a text message that I'll get myself in trouble by answering. He asked if I would do any other emergency orders, I guess if I were governor. That's a hard thing. So early on, I sent out a letter with Dr. Mayor Brad Cohen of East Brunswick, and we urged the governor to go stricter, and basically he's come to where we said. I can make all the suggestions I want, but I don't have I'm a doctor and a mayor, but I don't have the economic impact information. So, I would go very strict without that information or without that concern, but that concern does have to weigh on the governor. So it's easy to suggest, it's harder to decide. What I would say is, and I bet this will raise Mr. Vornlocker's and maybe Lieutenant Rizzo's eyebrows, I'd like to see a stricter curfew, but performing, or what's the word I'm looking for? The actual administration of that would be extremely difficult because you still have to have essential workers out there. Are you really going to ask an officer to start stopping every car to see, are you an essential worker or not, et cetera? So that might be just difficult to administrate, but I would like to, what I would like is for people to actually just adhere to the curfew and in general stay home unless they absolutely have to go out.
I think one thing I just wanted to add about the status of people in the area, and I mean the more central Jersey area, who are homeless or in need of support around food is, I know that there have been hotels that have been provided for a number of people in the New Brunswick area, and but it's evolving and the data isn't there. I had talked to some people today. I know that Elijah's Promise is setting records for the number of people that are being served at the soup kitchen, and their staff are being taxed to the limit. So that's another organization that definitely deserves support. Another organization in the area is, I have to find it, the Diaper Pantry. So I put a link on Franklin Direct. And so that obviously diapers are very costly. Times are getting harder and harder. So that is another nonprofit that's worthy of support. But I'm going to try and get some additional information to share. And I know there's a number of meetings that are happening that should be able to provide some information around homelessness and some of the supports that are happening there.
Michael, I'd like to add one more thing. And I'm watching the feed on Facebook. As we're discussing this.
Yep.
211 is the service that's provided to the state of New Jersey residents to provide access to other governmental services. This is not because of COVID-19 that now 211 will provide temporary housing for those who are homeless. It's that most offices are currently closed to the public, and there needs to be some method to contact the social service agencies that provide temporary housing to the homeless. Those services are always available to our public that are in need. However, given the current circumstances, there has to be a method to contact them. That is the method to contact them right now.
Right. Township Manager, if I could ask you another question that came via email, and also I see in the feed, was regarding testing centers and any testing center that might be within the township or on hold within the township.
So I saw the mention of a testing center on Davidson Avenue. Fairfield Hotel is, I believe, what the people are referencing. That is, and I don't know the schedule for it, but it is a drive-through testing center for professional first responders only by appointment. That was set up privately for professional first responders and who are symptomatic, and that is not open to the general public. I also saw a comment on the Facebook feed. Brunswick Urgent Med is a medical facility on Route 27 in Delar Parkway. That is a private medical practice, and they are also doing outdoor testing. That is not a drive-through testing service. What that is if you are symptomatic and contact them and make an appointment, they are doing their testing outside rather than bringing symptomatic people into their building. So that's what that is. It's not a drive-through testing facility. It is an outdoor, by appointment with the doctor, testing facility. As far as I know, we've seen some discussion on the Facebook feed, and I don't know if it was in the questions in the email you sent, Mike, but the issue of a county drive-through testing facility is one that the mayor and the lieutenant and I and about 75 other people have a conversation about every day. And that's with the county mayors and county administrators and county staff and assembly and state senators and Congress people, as the frustration is high for the lack of a drive-through testing facility in Somerset County. We believe at this particular point that the beginning of the process to put one up at Raritan Valley Community College, we're hoping should be able to begin next week, beginning of next week, so that can go online, hopefully at some point later in the week. This is all contingent on the ongoing acquisition of the necessary PPE to put a drive-through testing facility up, as well as the test kits themselves. All of these things in great demand and very difficult to obtain. And just not only difficult to obtain, but as we heard again on our call today, Somerset County purchased 35,000 N95 masks to be distributed to long-term care facilities, hospitals, and first responders, and also to be used at when they put up a testing facility. And prior to delivery, that delivery was seized and taken by the federal government. When that happens, it makes it even more difficult for municipalities on our side, counties a little bit higher than us, but even certainly at the state level, for us to obtain the necessary equipment to run something like a testing facility. And so that's where we're at, and it's very, very frustrating. And I know people want to see it, but I think that there are alternatives if you are symptomatic, and if you are symptomatic, you need to speak with your physician or go on any one of the websites now for hospitals that you can do telemedicine and be diagnosed that way. If it's recommended that you be tested, you get a script, you go to one of the testing facilities and you get tested. We need to do more, But right now, I believe that we're trying as hard as we can to get it up as soon as possible.
Okay, thank you, Township Manager. I just wanted to mention in terms of these town halls, as we kind of improve here, now we had to funnel this through my personal page because of a technical problem, but in general, with regard to comments, we've asked people not to pose questions only so that I can find them, not ask each other questions, and be sure to put a question mark at the end of your question, because as I try to sort through them, it's very difficult when people are on pontificating and giving advice or opinions and things like that. So I want to really respect the questions that we have coming through, because I'm not always sure I can find them in the mess. So I appreciate that in the future. Are there any other comments that you all have seen in the thread that I may have missed, or do we want to have any final comments from the panel before we close up?
Someone was asking about the repair of a standby generator. I assume that would be considered an emergency repair.
Yes, it would. You know, Michael, there's one other question that you had on the list of questions that you sent to us that I think that both John Ravalli and I might want to at least touch on, and that's about the counseling resources for our anxiety grief coping mechanisms in place for district students and families who are feeling the impact of COVID-19. I know on our side, there are a number of mental health resources listed on our website, both for adults and children and families. And I think that if, you know, in this, it is a very trying time, and not whether or not there's someone ill in the house, I still think that it takes a toll on our kids. And I think that, you know, if you need some resources, I certainly would refer you to our site, where it also then refers you to county and state mental health agencies, and just some good suggestions, and then also some opportunities to do things through our website with the recreation department that might just be an opportunity to you know, put your kids at ease. And I'll let Mr. Ravalli touch on it.
Thanks, Bob. And yeah, we have a lot of that information duplicated on our website under a link called Health and Wellbeing Resources. But in addition to that, I would urge anyone, you know, we have our school counselors are actively working, our school assistance coordinators are actively working. Of course, our teachers are monitoring as well. So if a parent becomes concerned, a guardian becomes concerned about their child, certainly reach out to your teacher, reach out to your counselor. If you're not sure who the counselor is, the guidance counselor in your school, reach out to your school principal, and we will make contact. You know, we do have trained folks in that area, school counselors, student assistance coordinators, and they will make contact with you if you have a need. But in addition to that, as Bob said, we have lots of resources listed as well on our website under that Health and Wellbeing Resources page. So please leverage what we have to offer. Our folks are extremely knowledgeable when it comes to assisting students, especially in moments of need. So I urge you to reach out either through your teacher, through your principal, or through your guidance counselor if you believe that your child happens to be struggling. So.
Okay, thank you, Dr. Ravalli. Any other comments from the panel? The one thing I just wanted to draw people's attention to is that we do have a Facebook group that is going to be starting to kind of be built up and paralleling some of the posts from the mayor. If you all want to join that group, it's Franklin Direct, one word. So if you, we'll put that up on the mayor's page, and you'll be able to join that group. And if you, we'll also put instructions on how you can set settings. I know some people have complained about, you know, conflicting information coming from various Facebook groups, but this Franklin Direct group is really a one-way group. It's not a discussion group. People can't post on it. It's really just to provide information that's been vetted. And so if you want to, and you can set your settings to get every post if you want to, so you're welcome there. I think that's it, Mr. Mayor. You want to sign us out? Yes.
Sorry, can I just chime in with one item I received? Unfortunately, I didn't get to advertise this last week, but the Stagehouse had sent me a notice that they're offering meals for Easter to seniors that can be delivered. Unfortunately, today was one of the 2 days to order, but tomorrow you can still order between the hours of 11 a.m. and 1:30 p.m. and they would be delivered on Saturday the 11th. So this Saturday. Those that need a meal that can feed up to 2 people can call 732-873-3990 between 11 a.m. and 1:30 p.m. tomorrow. And again, thank you to the Stagehouse for offering that, and also thank you to all our businesses that have been offering stuff. The Chamber of Commerce has been in touch with me to see what they can provide. And we've extended that also to Dr. Ravalli at the school board that our businesses are trying to help out as much as possible. So in addition to everything else.
Thank you, Councilman. One other quick thing was, I'm sure you might have mentioned it, but for residents, helping residents, the Facebook page and website if possible.
Again, I saw somebody posted in the chat, so I appreciate that. The Facebook group that I know offhand is RHR Franklin. So facebook.com/RHR Franklin. The URL I'm a little fuzzy on, so if you go to that Facebook group, then you'll be able to get there's links for requesting help and providing assistance.
Yep. One quick thing I wanted to mention for people who are here on Facebook, who likely have Facebook accounts, what you can also tell people who are not on Facebook, just as with this live broadcast, people can access it without a Facebook account directly because the mayor's page is a public page. So they can go directly there to Mayor Phil Kramer is the page name, and anyone can view it. Additionally, we've recorded this as we have previous broadcasts, and we will be posting on the mayor's page. We will have it up on YouTube, and we will provide that link as well. Anything else, Mr. Mayor?
Yes, I've said it before, I'm going to say it again. You need to assume every person you encounter is infected, because people who are asymptomatic can pass on the disease. And you need to assume that you are infected when you encounter every person. So have that courtesy. It is one for all, and stay the Franklin home.
Amen. Thanks, everyone.